Hello and welcome to JAMA Network Open Conversations. I'm Angel Desai, Associate Editor for JAMA Network Open. Today we are speaking with Dr. Edith Chen about family disadvantage, education, and health outcomes among Black youth over a 20-year period. Welcome! To begin, can you please introduce yourself?
My name is Edith Chen. I am a professor at Northwestern University. And thank you very much, Dr. Desai, for welcoming me onto your podcast.
Just to start off, I wanted to say this was a really interesting study to read, and I wonder if you could start by discussing a bit about its background.
Sure. Thank you for that. The idea for this study began with thinking about the implications of the narrative that is quite prominent in American society today about upward mobility. That is, the idea of pulling oneself up by one's bootstraps, and the idea that that's a desirable thing and something that perhaps all Americans should be striving for. And it's generally framed as something that's a positive, with the assumption that there would then, of course, be beneficial outcomes that accompany upward mobility. But in some preliminary earlier studies, what we were observing was that there seemed to be this divergence of mental and physical health profiles when it came to upward mobility. That is, we found that upward mobility was generally associated with positive mental health outcomes, but sometimes associated with poor physical health outcomes, particularly among Black and Latinx individuals who grew up under financial hardship. And so we came to call this phenomenon skin deep resilience because it indicates the idea of upwardly mobile individuals achieving success by many external metrics. So, for example, going to college, achieving higher incomes, having good mental health. But at the same time, below the skin, these individuals appear to be struggling in terms of their physical health, therefore displaying resilience that's only skin deep. And so this is about the idea that overcoming adversities, such as financial hardship in one's childhood, can sometimes be associated with a trade-off. So, for example, when mental health is achieved at the expense of physical health. And so in the current study, what we wanted to do was move beyond previous research by conducting a longitudinal investigation in which we could track mental and physical health outcomes over time, and to be able to focus on the effects on one particular racial group, that is Black youth. And so we wanted to focus on adolescence so that we could take more of kind of a prevention approach, that is studying precursors to chronic diseases earlier in life before the diseases manifest. And then also in the study, we wanted to better understand, in addition to clinical outcomes, some measures of potential biological mechanisms such as inflammation.
This is a great overview. Can you tell us a bit about the longitudinal data source used from the Strong African American Healthy Adults program?
Yeah, so what we did was we followed a sample of Black youth for about 20 years, starting from when they were age 11 to age 31. When they were in their teenage years, we collected measures of financial hardship by asking questions like whether the family had enough money to afford the clothing, food, and medical care that they needed. And then we followed the youth into adulthood. And here our measure of upward mobility was about their educational attainment. So whether or not they achieved a bachelor's degree, because almost none of their parents had. And then at the age of 31, all of these participants were reassessed on a variety of mental health outcomes, including things like anxiety, depression, anger, aggressive behaviors, and emotional reactivity. And then we also measured substance use, including smoking, binge drinking, and drug use. And then for physical health measures at age 31, we measured metabolic syndrome, which is a cluster or constellation of risk factors for diabetes and cardiovascular disease, and typically diagnosed through markers of obesity, high blood pressure, cholesterol levels, and high glucose levels. And then finally, to get at the biological mechanisms, we measured what's called a pro-inflammatory phenotype. And so this is a tendency for immune cells to mount excessive inflammatory responses to microbial challenges like bacteria or viruses, and also about the tendency for immune cells to become insensitive to hormones like cortisol that typically signal for inflammation to stop.
One of the variables that you just mentioned described the pro-inflammatory phenotype. Can you discuss this a bit more and the rationale behind its use?
Sure. So it's a measure that tries to get at the way that immune cells are functioning as opposed to simply measuring biomarkers of inflammation like C-reactive protein. This is more of a functional measure, so trying to assess how immune cells are functioning by essentially creating in vitro models for assessing that. So what we do is that we draw blood on participants and then we expose their immune cells to products like bacterial wall or a viral product, and then the immune cells will typically mount an inflammatory response. And so what we're looking to measure is the magnitude of that inflammatory response in terms of their production of these pro-inflammatory cytokines, with the idea being that for individuals whose immune cells mount a more aggressive pro-inflammatory response, these are individuals who might then down the line be at heightened risk for diseases involving inflammation like cardiovascular disease. So the idea of doing this kind of measure is that particularly in younger people, it's a way of potentially getting at a risk marker for potential diseases later in life.
What were your main findings of the study?
So we found that youth who went on to get a bachelor's degree as adults had fewer mental health problems and less substance use. And because this was a longitudinal study, we also had these same measures during the teenage years. And so what we were able to show actually is that youth who went on to get a bachelor's degree actually had greater decreases in mental health problems and as well greater decreases in substance use over a 15-year period from adolescence to young adulthood compared to those individuals who didn't get a bachelor's degree. But then in terms of physical health outcomes, what we found was that it depended on the level of financial hardship that youth grew up with. So for those youth who grew up without financial hardship, those who went on to complete a bachelor's degree had a lower risk of being diagnosed with metabolic syndrome in adulthood compared to those that didn't have a bachelor's degree. However, for youth who grew up under financial hardship during their teenage years, those who went on to complete their bachelor's degree, in this case, had a higher risk of metabolic syndrome as adults compared to those who didn't complete their bachelor's degree. And we found a similar pattern when it came to this pro-inflammatory phenotype. So that is among youth who grew up without financial hardship, those with a bachelor's degree exhibited less of a pro-inflammatory phenotype in adulthood compared to those without a bachelor's degree. However, among youth who grew up under financial hardship in their teenage years, those who went on to complete their bachelor's degree exhibited more of a pro-inflammatory phenotype in adulthood compared to those without a degree. And as with mental health, with physical health markers, we also had earlier measures in the teenage years of physical health. So these patterns held up even after controlling for earlier health measures. So these findings indicate that what we think of as the positive outcomes associated with upward mobility, things like better mental health and better physical health, they are there for Black youth who grow up under good economic circumstances. But for those who grow up with greater financial hardship, if they're striving for upward mobility, for example, by seeking educational opportunities, in this case, they're likely to have good mental health, but poor physical health in adulthood, suggesting longitudinal evidence for this idea of a skin deep resilience phenomenon, particularly in this population of Black youth transitioning from adolescence to young adulthood.
Some really interesting findings. What do you think are some of the possible explanations for this disconnect noted in the study between upward mobility, mental health, and physical health outcomes among this cohort?
Yeah, that's a great question. So we have some ideas about why we think these associations exist, although we certainly need to do more research to determine which of these possibilities is correct. So we think that some of these patterns might exist because for many individuals who grow up experiencing disadvantage, the path to success is paved with multiple challenges and hardships. So, for example, for many of these young people, school might not be their only priority. They often will have to balance a lot of competing demands. So, for example, trying to succeed in school while they're also holding down a job to help support their family, or while they're tending to multiple family obligations like taking care of younger siblings. So there may be many competing demands on this particular group of youth that can take a toll on stress response systems. Or alternatively, or in addition, as these youth move into higher educational and professional workspaces, many of these individuals may have experiences with interpersonal discrimination, social isolation, or structural racism, for example, in the kinds of employment opportunities that are available to them. These kinds of experiences that marginalize certain groups and that, when experienced repeatedly, are thought to weather physiological systems. And then in addition, we also think that these are also individuals who individually are showing a dedicated commitment to hard work and a single-minded determination to succeed in terms of striving for success. And that when you have individuals who are doing this in environments where they lack sufficient resources or where there are a lot of barriers to success, that having to put forth this kind of effortful striving persistently across the course of years may also take a cumulative toll on the body.
Without going too far out of scope, what would you say are some of the broader implications of this study from both a public health but also policy perspective?
First, we need to gain a better understanding of exactly when during childhood or adolescence skin deep resilience emerges. So we need more developmental studies that kind of track it across time that will then allow us to be able to, in the future, more precisely time preventive interventions. And then second, I think we do need a better understanding of the reasons why skin deep resilience emerges, as I was alluding to earlier. So is it that striving for success, that hard driving work ethic that individuals are exhibiting that is taking a toll on their physiological and physical health? Or is it things like lack of time for healthy behaviors when you're balancing a whole host of competing demands that make it then hard to engage in the behaviors that can keep you on a healthy trajectory? Or is it that experience of discrimination or social isolation if you're one of few Black individuals or one of few individuals who've come from a low socioeconomic background in the kind of spaces that you're now finding yourself in as a young adult that create stresses that take their toll physically on the body? And so if we can better understand which of these pathways are the key pathways explaining skin deep resilience, I think this will allow us to develop interventions that more accurately target the key factors that we need to try and change. And third, I think we need to work on creating such interventions. So work on creating interventions that are considering individuals more holistically across multiple life domains. So for example, across both the mental and physical health domains, so that we don't inadvertently administer interventions that are benefiting one life domain for an individual, but actually coming at the expense of another life domain for that same individual.
Thank you so much to Dr. Edith Chen for speaking with me today about this very important topic. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.